My name is Kim Cronin Gifford, and I'm the mother of 3 children affected by Lyme disease. We have a GoFundMe that we started, a family member started about a month ago for the kids in regards to their treatment. Many people don't understand what Lyme disease is, they only understand what they've been told by doctors. We were in the same position about almost 2 years ago with our son, Cole. Cole was 12 at the time, about to turn 13, and Cole began sleeping all the time, falling asleep in school. His teachers came up to us and expressed concern because it wasn't like him. Cole was also sleeping at home. Then January 4th, 2015, Cole caught a virus from his younger sister, and Cole never got better. Cole started sleeping 15, 16 hours a day. He was semi-lethargic. 3 visits to the emergency room. 1 resulted in him being kept overnight. The doctors had no idea what was going on. They tried to tell me he had a sinus infection. They tried to say it was migraines. He was given IV medicine, migraine cocktail, and it didn't touch his headache. He was dizzy. He just couldn't concentrate. He had no appetite, and things got worse. That he ended up sleeping 22 hours a day for about 2 weeks. We were referred to a neurologist. He got sent for an MRI. They found a small mass in his brain, which they blame on being a hamartoma, which is basically displaced tissue, and that it was nothing to worry about. Then the neurologist started to blame everything on depression, which I would understand if that was Cole. That wasn't his temperament. He wasn't depressed. He just was sick. He didn't feel good. At this point in time, he had missed about 3 months of school. So after trying him on medicines that didn't work, that didn't change anything, I sent him to acupuncture. And the acupuncturist detected that there was something similar to Lyme, meningitis, or mono. What I didn't mention is starting in December of 2014, Cole's blood work showed mono-like symptoms. His neutrophil counts were very low. His lymphocyte counts were very high. Those two things are white blood cell functions and testers that they use in blood tests, and they were not right. His thyroid level went up. His white blood cell count was low, and it stayed that way. We finally got a referral to go to Boston Children's Hospital. Now this is about May. Cole obviously didn't finish school. Acupuncture made him feel a little bit better, but then we noticed once he went back to school, or tried to go back to school, reading or learning anything new brought on these severe headaches and would make him completely exhausted. So Cole stopped going to school. We had to pull him out. The school he was in did not pass him for 7th grade. We knew that we were not going to be able to send him to school, so we tried to do homeschooling. But first we went to Boston, and the Boston neurologist tried to blame it on headaches and depression, didn't listen to anything that we were saying, wouldn't even test Cole's blood. So we went on to the next doctor. She said we should go to infectious disease at Boston Children's Hospital. So we went to infectious disease, and they looked at us when we asked about Lyme and said there was no possible way, and that they have the test to find out, and that she would only take Cole's blood to settle my nerves. And about 3 hours after we left, she called me back apologizing because Cole's blood work was so bad. They wanted him to go to hematology, and she was hinting that it could be a leukemia or some type of blood cancer. So we waited 3 weeks to see hematology, and hematology didn't know what to make out of Cole's blood work. There was something wrong, but they couldn't figure what it was. They told us once again it wasn't Lyme. Had a bunch of tests, go back a week later for the results of the tests, and they had no answers for us. They then again referred us back to neurology, and then Now it's August, and our son has been sick now for 10 months. While this was going on, our youngest Isabella got bit by a tick, and we saw the ring, and she went to urgent care, and she got the dose of dioxycycline she was supposed to get. She was on it for 6 weeks, and she started being tired all the time. She started to lose her appetite and just not be herself. And we had some friends that had Lyme that started suggesting that we should look into a Lyme literate doctor. But being scared and starting homeschooling with Cole and realizing it wasn't working and he wasn't feeling any better and he was repeating himself and forgetting everything. His memory was awful. He used to be a kid that played all the time, and he had so much energy, and that was gone. And now Cole adapted to just not feeling good. And then Isabella started. So we went back to Hasbro Children's Hospital in Providence for one last time to hematology to see if they can give us any answers. And once again, the doctor looked at me like I was crazy and said there's no possible way that he has Lyme disease. So we hit a roadblock and we didn't know what to do. So a friend of mine, thank you very much, Mike, gave us a doctor in Connecticut. 3-month waiting list to see this doctor. Had to pay out of pocket $950 for the first appointment. And we took Cole mid-December, and he thought it was Lyme disease right off the bat. He did a whole bunch of tests, vitamin tests, antibody tests, private lab tests for Lyme disease. And on January 12th, we found out that Cole had 2 different types of tick-borne illness, mycoplasma co-infection. His body was fighting itself. He had multiple vitamin deficiencies. He had POTS syndrome, which is stems from his nervous system being out of whack from the Lyme disease. And when we learned about Cole, we started noticing with Bella and from her teachers that her memory was starting to go, her concentration. She was getting headaches in school. She was spelling words wrong. And Isabella was at an 8th grade level for the 5th grade. So we got her appointment. And it found that Bella had one same type of tick-borne illness as Cole and a different one. And she also had the co-infection. And we started treatment for both of them, but it wasn't working. We weren't seeing enough differences. Their numbers weren't really changing. At one point, Cole was on 3 strong antibiotics and antiparasitic along with other supplements and herbs. Bella the same. And around March, Gigi started napping all the time, which was totally unlike her. We ignored it for about a month because we were dealing with Cole and Isabella, and we just didn't want to face that it could be the same thing. And then we made an appointment for Gigi after her having body pain all over for 2 straight weeks. We took her to the ER. She had an x-ray. She had an MRI. There was nothing physically wrong causing her body pain. And sure enough, Gigi also has 2 different types of tick-borne illness. She doesn't have the mycoplasma co-infections, but she had other ANA issues and other different issues. And we hit a roadblock because now all 3 of our kids are infected with something that everybody is told gets better with 4 weeks of antibiotic, and it's not the truth. Gigi missed the last month and a half of school and barely passed her 6th grade year. And then in the middle of all of this, my husband lost his job, so not really finding anything in the area, we started searching for doctors that had better or more therapies for Lyme disease, and it brought us out to Colorado. And now they're going through daily treatments for the next 6 weeks, but it's just the IV treatment that's 6 weeks. There's going to be more treatments. And what I'll say is, so people can understand, is I had 3 awesome kids, and I still have 3 awesome kids, but they're not them. And to watch them suffer every day and not be themselves, and have people think that this isn't a problem, and the fact that I know that people that I know through the gym and through different things have had Lyme disease, or they think they have Lyme disease and they can't afford to go to a doctor because insurance doesn't cover it. It's just completely ridiculous, and I need everyone to understand that my child missed his first day of high school. He'll never get that back. He missed his 8th grade graduation. He missed making friends. He missed making memories. Now my daughter missed her first day of 7th grade. My other daughter missed her first day of 6th grade. They're not in school. They're in a completely different state where they don't know anybody. And for what? There's tons of research that shows that Lyme disease exists, that chronic Lyme disease exists. There's famous scientists from all over the world that have done research, and nobody's listening. So when this is all said and done, someone's going to have to pay for this eventually. But at the end of the day, if you were told, or your children were told, that they have something that there is no cure for, that both Cole and Giovanna, we know, have gotten bit by ticks. They never had a rash, ever once. Isabella's the only one that had a rash. And this is their life now. They're living in a hotel. They have IV stuck in their arm. They have only friends to talk to over the internet. They have to have a completely gluten-free diet. They have to sit for 5 hours and get IV drips and things put in their arm, and they have to take 22 supplements a day, and it's not how a kid should live. It's not how anybody should live. And I know it might be hard for some people to understand the severity of this because you've been told Lyme disease isn't a big deal, but it's a big deal. So I'm going to start cataloging their journey and videoing their journey a little bit more in depth and letting them tell you what it's like. And maybe enough people, they can help other people who are in the same boat.